I believe the main, if not predominant, exposure to mercury in the public is from dentistry while placing and removing of amalgam fillings. Hello, I'm Dr. Roger Eichman. I've lived most of my life here in Juneau and have practiced dentistry here for 26 years. As a child, I went out prospecting and panning of gold in the hills around here, and it gave me a perspective of geology. From geology, I learned the field test for mercury. I have applied this test in dentistry, and this is what this video is about.
Dr. Roger Eichman graduated from Creighton Dental School in 1971 with honors. He served on the Alaska Board of Dental Examiners and has recently retired after practicing dentistry in the state of Alaska for more than 2 decades. He is also a member of the Alaska Miners Association and on their board of directors. He has served as president of the Juneau Mining District and has been active in prospecting for most of his life in the Juneau area. Dr. Eichman offers the dental community a unique perspective on the amalgam controversy with this video. His knowledge of the prospector's field test for mercury is adapted to detect mercury emissions from different industrial environments. In the next 15 minutes, we will show how poisonous mercury gases in dentistry can become visible to the naked eye through fluorescence. We'll do this with the simple field test of mercury. The science of atomic absorption and the use of a black light makes this possible. Next, we will review the industrial uses of mercury in goldsmithing, dental lab castings, switches and thermometers, and reveal the total amount of mercury used in America. Then we will show how mixing silver and mercury in dentistry produces a high volume of poisonous mercury gas. The American Dental Association does not recognize that there is a release of mercury after the initial setting or that there is vaporization from the silver amalgam over time. There are alternatives, composite fillings, which are as good or better than traditional filling materials. Finally, we will see an interview with Dr. Eichman, who has been researching the links between mercury in fillings and illness for 2 decades. In order to do a prospector's field test for mercury, one needs a fluorescent screen of some sort. Any well-laundered white cloth, such as a t-shirt, will do. The other major component is a mineral black light. This is a long-wave black light with a purple filter and white fluorescent tubes. This is a short-wave mineral black light with a filter and clear fluorescent tube. It is critical that you use a clear tube, not one with the white powder on the inside. There are several black lights on the market that work very well. They range anywhere from $150 to $350. The one that is being demonstrated here is a 12-volt short-wave black light that breaks down, showing the fluorescent tube. The clear tube contains vaporized or gaseous mercury, some of which has solidified to form the small silver-colored beads as seen in this snapshot. When you turn on the short-wave black light, electricity goes through the tube and energizes the mercury. The energized mercury emits light at different frequencies, and the purple filter separates out the visible light, allowing only ultraviolet black light to be transmitted. This black light, striking another object that can absorb black light, will sometimes retransmit it as a visible light. This is called fluorescence. For example, the whiter-than-white brighteners in laundry soap are fluorescent dyes. As you see here, when viewed with the short-wave black light, these soap dyes fluoresce blue. However, viewing an object with black light is not the same as seeing an object with reflected light from the visible light spectrum. With fluorescence, objects are absorbing atoms to become visible to the naked eye, rather than reflecting light from the visible light spectrum. Fluorescence is not reflectivity. Using the principle called atomic absorption, we can show how the shortwave black light can help us see mercury vapor with the naked eye. The only gas that will absorb exactly the same frequency of light that is emitted by an atom of mercury is another atom of mercury. Since the excited mercury atoms in the black light become gaseous and filtered, they are extremely sensitive and 100% accurate in revealing mercury atoms in the path of the black light. When we take a mineral containing mercury, such as cinnabar, which is mercury sulfide, and place a small chip of it on a spatula and add heat at our lab, what appears to be smoke can be seen with our shortwave black light. What we are actually seeing is the smoke-like shadow cast on a fluorescent screen of mercury vapors as they rise from the heated cinnabar. The atoms of mercury released by the heat absorb the atoms of mercury being transmitted by the black light. The result? A visible shadow. We will use this field test for mercury to detect mercury emissions from different common industrial environments. Jewelers and goldsmiths are exposed to mercury. In making nugget jewelry, for example, the natural nuggets are soldered onto a background matrix, a very common practice throughout the United States. What is not commonly recognized is that almost all natural gold has mercury absorbed into it. On heating of the gold, the mercury is boiled off and exposes the goldsmith to vaporized mercury. Hoods, or vapor-limiting protections, are not commonly used in jewelry manufacture. The gold is directly heated and soldered in the open air without any protection. Unfortunately, as you can see in a black light test at our lab, a great deal of mercury is vaporized when natural gold is heated, exposing the jeweler to a highly toxic gas. Another exposure is in dental lab castings, where technicians may remelt old gold to make dental crowns and dental work. To heat and repair old crowns, such as contacts or a hole in a crown, they take a crown that has been in a person's mouth for many years, heat it up, and add gold solder to it. Here you can see, in a blacklight test in our lab, the mercury coming off in quite large amounts after being heated. Other minor exposures to mercury may occur from the breaking of fluorescent light bulbs, to the spilling of mercury from broken electric mercury switches or mercury-containing thermometers. These are fairly small exposures compared to one of the most significant exposures to mercury, amalgam fillings. It is Dr. Eichman's opinion that the placement and removal of mercury fillings exposes more people to mercury than all other sources put together. The U.S. Geological Survey Mineral Commodity Summaries as of February 1997 list the United States consumption of mercury at approximately 400 tons per year, with 7% for dental supplies. This is used in silver amalgam fillings, which traditionally contain close to 50% mercury when placed in the tooth. Dentistry uses mercury by taking a powdered silver alloy and mixing it with a couple drops of mercury. This is packed into a hole in the tooth. Dentistry currently places about 28 tons of mercury a year in people's mouths. What is not generally recognized is the amount of mercury exposure during the process or in removing of old fillings. In mixing of the silver, we use what is called a triturator. An amalgam capsule is placed in the triturator and turned on. It shakes the powder and the mercury together and mixes them. As you can see in our blacklight test, when you open the capsule, large amounts of mercury are vaporized due to the heat of trituration and the fresh active mercury. This fuming mixture is now placed directly into the mouth and packed in place. It takes several days for the mercury to dissolve completely into the silver and become fully amalgamated. During this time, it is going to vaporize. The American Dental Association does not recognize that there is a release of mercury after the initial setting, or that there is vaporization from the silver amalgam over time. If you take an extracted tooth with an old amalgam filling and just scratch on it, you can see the mercury vaporize. Notice this is not just while scratching on it, but it just keeps on coming, even a while after the surface has been polished or scraped on with a knife at room temperature. Keep in mind the vapor pressure of mercury increases with temperature. Every 10 degrees Celsius rise in temperature almost doubles the vapor pressure. It does not go to zero until it is below 0 degrees Fahrenheit. Therefore, any amalgam in the mouth which is at body temperature is going to continue to degas as long as it is present. It will be more active after chewing or dental polishing or any manipulation from a dentist in a dental procedure. A simple proof of this is to take an old amalgam filling and have it assayed for percentage mercury content. Dr. Eichman has seen assays as low as 27% mercury. Since fillings are placed at around 50%, then a drop below 30% mercury means 40% of the original mercury evaporated out. Added exposure would be from corrosion and normal attrition or wear of the filling. Other problems occur with silver fillings. In this patient, note a silver filling here and what appears to be a cracking tooth. This is typical of silver fillings as they tend to expand with age and show metal deformation and black corrosion. The buildup of internal pressure inside the cavity puts pressure outward on the walls of the tooth and many times will crack the tooth. Fortunately, we have alternatives to silver fillings that are as good or better than traditional filling materials. These are called composite filling materials. They are a mixture of powdered ceramics and plastic, and as time goes on, companies are producing better ones. However, when Dr. Eichman first started working with posterior composites, there were no acceptable materials. He took an anterior material called isopaste, which does not show up on an X-ray. He mixed it with some powdered silver and placed it in this tooth in 1977. In 1997, 20 years later, you can see the original carving. The contacts are good, and the X-ray looks good. Even though it is a dark color, this is a fully acceptable posterior restoration. It has been in service for 20 years with no appreciable wear. This is the oldest posterior composite that Dr. Eichman can document anywhere in the world. This filling was done with a total etch technique with total enamel bonding, long before such techniques for posterior composites were generally accepted. The present generation of composites look better and they should wear just as well, if not better. For further information on the medical effects of mercury, refer to any of the numerous books in the public press or to the many reports in medical journals. One item missing from all past reports is a simple way of visualizing the mercury evaporating. The Prospector's field test for mercury solves this problem and shows why the dental amalgam controversy won't go away. You've just seen a video presentation about the mercury hygiene controversy. With me in the studio now is Dr. Roger Eichman. How did you first become interested in mercury and dentistry?
I wrote my first paper in dental school in 1971 on mercury, and I was also very interested in gold as a teenager and geology and any of the sciences, but we had to write a paper in dental school, and that was when I first started researching it and wrote my first paper on it.
Can you tell me about some of the problems in dentistry that occur when you use mercury in fillings?
Not only does it cause a problem in the patient, but the dentists themselves tend to get exposed to mercury, and this is showing up in the tables on longevity of dentists. We have one of the shortest life expectancies, one of the highest suicide rates, divorce, accidental death, so on. It shows up in those tables. They're relating it to stress. One of the problems when you get exposed to mercury is you get personality changes and depression. These hinder the dentist then from handling stress. You don't have these statistics showing up in neurosurgeons, oral surgeons, orthodontists. It's in the general practitioner. And what I maintain is the difference here is the general practitioner is using mercury. These other specialties which have higher stress aren't using mercury, and they can handle the stress. The general dentist has a problem of handling that stress because of the mercury that they're being continually exposed to.
Does this have to do with the way the mercury affects the cells of the person exposed to it?
One of the things that mercury does is it will bind to enzymes in the body, such as thyroxine. If it binds to thyroxine, then it will reduce the functioning of thyroxine down to as low as 1/4 of its normal function.
And what does thyroxine do?
Thyroxine is the enzyme in the body that runs the energy system. So you're depressed, low energy values, you're not dynamic, and in the brain it functions directly within the brain, causing depression.
You maintain it could cause much more serious illness in some patients.
With some patients, and it's genetically controlled here, in some patients the mercury can bind to the sulfur containing proteins in the body. If this occurs in the spinal cord, and now you'll have a mercury protein complex, the body may take a look at and say, this is a foreign protein. It'll attack it. If it attacks that complex, the mercury-sulfur protein complex in the spinal cord, you call it multiple sclerosis. If this complex is in connective tissue in the body, tendons and blood vessels and so on like that, you'll probably now be calling it lupus erythematosus, which is quite common more common in women than it is in men. But it is still basically the same mechanism of action in the body. You have mercury chemically combining with the sulfur of a protein. And glutamine is one of those proteins in the body containing sulfur. So to treat these disorders, one needs to remove the mercury out of it and thereby correcting some of the autoimmune diseases, some of the connective tissue diseases, plus you get into the mental function which is working in the brain. Now in dentistry, we're releasing gaseous mercury from the fillings, more so than chemical mercury. The body will react to the chemical mercury, but gaseous mercury will go through the blood-brain barrier where many of the mercury chemicals won't. And setting with the teeth here with degassing mercury directly, the brain is right up on top of it, and it will then penetrate the brain, whereas many of these other chemicals won't, and you get depression and you get all the psychological things going. It is very difficult to test on any one person to tell if there is a mercury component going on here. About the only way you can test for it is do a DMPS challenge test. Treat them with DMPS and monitor what comes out in the urine. Most all the other tests are invalid. They just don't give you a good, reliable test.
So it sounds like you're saying mercury in dentistry is dangerous.
I feel it is very dangerous. Mercury has been shown to be about 1,000 times more dangerous than lead. Nobody would consider putting straight lead in a person's mouth. They're taking it out of every place that we can possibly take it out of, paints and gasoline and so on. But mercury is still being used directly in the mouth. The problem is that it's not being recognized as being released from those fillings.
Why is that?
There is a vested interest there. It is easy to use. It has certain characteristics a silver filling does in that it's self-sealing. If it isn't perfectly sealed, it is still considered karyostatic. In other words, bacteria and decay doesn't occur under a silver filling even if it does leak a little bit. Another way of saying this is it's a bloomin' toxic and nothing will grow under it. The mercury release tends to kill the bacteria and stop some of the decay. We have better materials now, and we're getting better ones all the time. The composites are very good and getting better. Gold is expensive. It's hard to use. It takes a higher skill level than the amalgam filling. But with our present knowledge, I can't see any reason to continue placing of amalgam fillings in the mouth.
What you are saying is this is dangerous stuff, and I want people to know about it.
We have caused probably as much damage to the general population as we have been helping, fixing one tooth at a time and tearing the rest of the body all to pieces. And mercury it's about the most dangerous substance you can get out there to deal with, and it should be off the market. And my personal opinion is that if anybody is having problems, they ought to consider the mercury. You can't treat the mercury in the body unless you get the mercury out of the teeth first. Because DMPS, in pulling out of the rest of the body, will pull it out of the teeth. And you'll just dump another huge load of mercury right into the system, right out of the teeth when you use it. So you have to get it out of the teeth first, then out of the rest of the body. And if you get into Alzheimer's treatment, then you have to pull it out of the brain tissue, and that's the hardest of all tissue to get it out of. Then you have to have the option of different medical treatments to correct the damage that was done.
So what do you recommend then as a way of treating Alzheimer's? Does it have to do with ridding the body of this mercury?
What I feel is going on with Alzheimer's is an early exposure to mercury, which binds in the brain. It stays there for most of the life. It stops and interferes with the recycling of old proteins in the brain. And they've found a new structure. They've just found what a structure in the cells of the brain do. It's called a protosome. And basically, it's a tubular structure. And old proteins go in through that protein and is recycled. If this structure function is restricted, then this garbage in the cell tends to build up, and we call it plaque. That is basically what is going on with Alzheimer's. What we have to do to treat and reverse Alzheimer's is to open up these pathways, get the protosome refunctioning. There may be a genetic component here. The size of the protosome may be smaller in some people, so it's easier to block. But with mercury, it binds to the enzymes, including coenzyme Q10, which is very dense inside that protosome. so it can't recycle. As age goes on, the enzyme systems tend to diminish anyway until finally the proteasomes quit working and you end up with Alzheimer's disease. But it takes years later, and the exposure was early in life and a lifetime of accumulation of mercury. So we first have to find a way to remove the mercury out of the brain tissue, open up these pathways, then other action can be taken which has a potential of restoring the health of the neural function. So to treat Alzheimer's, you would rid the body of mercury. And there are certain chelating chemicals such as DMPS, which with urine testing and so on, you can tell how much is coming out until it reaches normal. But DMPS has not yet been shown to cross the blood-brain barrier and remove mercury out of the brain. So it's going to need some assistance to do this. One of the ways you can do it is with IV vitamin C plus glutamine, and that reduces the mercury in the brain, frees it so that the DMPS in the blood then can pull it out of the brain and eliminate it out of the body. Once that occurs, then the body should be able to recycle the garbage products. And with some of the other chemicals that are being, and medicines being developed in some of the labs with neural growth stimulators and so on, should be able to even possibly reverse some of the damages done from the buildup and the disease we call Alzheimer's.
So would you recommend that I go have my fillings replaced tomorrow?
That's a hard question. That is a real hard question. First of all, without doing an exam, I don't know what type of fillings you have, the quantity, or if you're having any medical problems associated with them. As a general rule, if there are no medical problems, if there are very small amounts, then probably not. If you have a history of it in your family of some of these disorders, then you may want to consider it very much. For instance, even cancer, though mercury doesn't cause cancer, one of the causes of cancer is a low immune system. We know that mercury lowers the immune system. It will lower the T4, T8 cell count the same as AIDS does. If you want to treat cancer, you need to bolster the immune system. One way of bolstering the immune system is to remove the burden off of it of mercury. And in that case, you have to do it, start with the teeth first. And if you had a history in your family of breast cancer, then one of the things you would do is remove all mercury exposure from that patient in your case. Otherwise, anything that'll burden the immune system, stress will do it, mercury will do it, other chemicals will do it. It's just one factor in the treatment. Just the removal of silver fillings can cause problems if they're not done properly, and it takes a certain amount of training and care and certain precautions. In removing of a silver filling, you can release more mercury and cause more damage than leaving them in place. So there are certain protocols of removal, and even the order that you take them out in can, in some instances, cause a problem.
Are dentists trained in this kind of removal?
Most dentists are not, no. There are certain ones in the country, and there's about 300 dentists now that are members of the International Academy of Oral Medicine and Toxicology. Their protocols are really quite good. There are other dentists which are not a member of that academy, and they are also trained in it. But the general dentist really doesn't understand or recognize the problem. If they don't recognize the problem, they can do a lot more damage in just going in, removing silver fillings, and most of the schools are not teaching proper removal.
Are there alternatives to amalgam fillings these days?
Posterior composites are working very well. They actually strengthen the tooth better than the amalgam. You don't get the electrical actions, you don't get the toxic reactions. They're holding up as well as natural tooth structure. They're really quite good and getting better all the time.
What are your future plans with this?
Well, I'd like to get the information out to the general public, particularly with patients that are having problems. At least they'll be aware of a potential contributing factor in their disorder. I have just sold my practice. I've retired. I don't particularly want to continue to work on patients on a hands-on basis, but after 26 years of practicing, there are some things which I've come to the conclusion of that I think will help the public more so than me just working on one patient at a time and helping one patient individually. If we can get the information out to the general public, I think we can help the masses from this.
What do you think about dentists who are still putting amalgam fillings in people's mouths?
My conclusion is that any dentist continuing to place mercury in patients' mouths is committing gross malpractice.
Dr. Roger Eichman, thanks for joining us.